Turning now to a health alert as sicknesses continue to climb across our region. We're getting answers tonight on how to keep your family safe and healthy and how local hospitals are implementing measurements to do just that.
Western Mass News reporter Madison Lazowski has details.
Whether you like it or not, masking up is seemingly making a comeback. It's a controversial but simple way to keep you and your family safe this respiratory virus season.
Well, this flu season has been a doozy, to put it mildly.
66 flu deaths in Massachusetts this season, and flu-like illness infection rates are very high.
And it's not just Springfield, Hampden County, Western Massachusetts. It's the state, the nation.
Dr. Esteban Del Pilar explains why Baystate Medical Center is stepping up their enhanced infection prevention measures across all of their clinical settings, especially after seeing the increase firsthand.
This season, I can tell you that the patients that I've actually taken care of that have been in the ICU with this have been young, otherwise healthy, and unvaccinated, unfortunately.
Baystate sending out a new advisory because of these increased levels, stating that all healthcare workers will be required to wear a medical mask in all patient care areas, and any visitor over the age of 5 is required to wear a medical mask in patient care areas as well.
Whether that is the hallway of the unit, the patient room, a patient examination room in the outpatient setting, we're encouraging our patients and we're requesting that our staff wear masking in an attempt to decrease any potential transmission of any of these viruses.
However, Baystate is also recommending that you take similar measures off of their property.
You're not feeling that great? Wear a mask. It's a simple enough thing that you can do.
Another simple action you can take.
Our first line of defense is actually hand washing.
All of these measures consistent with guidance from the Massachusetts Department of Health, and it follows data from the COVID-19 pandemic.
So with that data, we know that if we implement masking, we do see a significant reduction of number, at the very least for flu. And that's basically what we're aiming at, that with as much flu as we're seeing circulating in the community.
How long will Baystate's mandate last? Dr. Del Pilar says that only time will tell.
We want to make sure that we have another extra layer of protection for our staff and our patients to make sure that if we can prevent it altogether.
Reporting in Springfield, Madison Lazowski, Western Mass News.